Hello, everyone. My name is Gurjat Basra, and I'm the Manager of Patient Programs, Research, and Advocacy here at Lymphoma Canada. I'm pleased to welcome you all to the final session of the day titled Nutrition for Lymphoma and CLL Patients. Before we begin, just a reminder that this session is being recorded and the recording will become available following the conference. You will receive an email when the recording becomes available. At the end of the presentation, we'll leave a few minutes for you to ask questions and we'll try and answer as many as possible. So without further ado, to introduce our speaker today, we have here Dr. Carrie Cornea, who is a professor and is a research chair in physical activity and cancer in the Faculty of Kinesiology, Sport and Recreation at the University of Alberta. His research program focuses on the role of exercise after a cancer diagnosis, including how exercise might help cancer patients prepare for treatments, tolerate them, and respond to treatments, including recovery and long-term outcomes. So thank you so much, Dr. Cornea, for joining us today, and I'll hand it over to you.
Thank you, Gurjat. It's a pleasure to be back and speaking about the role of physical activity and lymphoma. I'll start off with some of the questions you might have about exercise. First and foremost, is it safe and beneficial to exercise with lymphoma cancer? And in particular, what's the effect of exercise on the lymphoma cancer itself? And then another important question you might have is, will exercise affect my lymphoma treatments? How I am able to get through the treatments, how I respond to those treatments. And then can it help manage treatment side effects, improve fitness, quality of life, and survival? And if so, what is the best exercise program for lymphoma patients? So I'll try and walk you through some of these key questions with the evidence that we currently have. So a lot of the exercise oncology research has focused on breast and prostate cancer. This might not surprise you as one of the lower profile cancers. Just like many other areas of research, the exercise researchers have spent most of their time studying breast and prostate cancers. We do have some exercise research that's focused on lymphoma cancer, and I'll share some of that with you. And some of the studies that have looked at lymphoma cancer sometimes study it within the hematologic cancers, including leukemia, multiple myeloma, or they have some patients who have completed stem cell transplant patients, and some of those participants might have had lymphoma cancer. But unfortunately, a lot of what we know about exercise and cancer is from these other cancer patient groups. So we do kind of have to extrapolate from that research to lymphoma patients. I'll start off with perhaps one of the more important questions you might have is, what is the impact of exercise on the lymphoma cancer itself? And so this is just answering the question, what's the impact of exercise on the growth and spread of cancers that are not being treated by any other treatment, just a straight up examination of the effects of exercise. So this is kind of like a active surveillance or a watchful waiting setting where there's no other treatments being given, but you're engaging in exercise. And we do these studies. These are preclinical studies in rodent models, particularly mice models, and we do them the same way the drug researchers would test their drugs. So you implant a small tumor in the mice or a small number of cancer cells, and then you either give them the drug or don't give them the drug and see how the tumor grows and spreads. In our case, we're able to give these rodents exercise or no exercise and find out what is happening to the cancer. So we've done many of these studies, 50, 60 or more studies have looked at this effects of exercise on tumor growth in these rodent models. And the general finding that we report in these studies is exercise does seem to slow the growth and spread of these tumors. And so this graph that I'm showing you here is the typical finding that we report. There are some studies showing no effects, that exercise doesn't influence tumor growth or spread, and even a very small number of studies that show accelerated tumor growth and spread. But the vast majority of studies show this general pattern. And what this suggests is there's some biological activity or some anti-cancer effects of exercise in these various cancer cell lines. although not many of these cell lines that we've tested have been lymphoma cancer. So this is a positive finding suggesting exercise might slow the growth and spread of cancer. However, it is in rodent models, and we know that that research oftentimes doesn't necessarily hold up when we test these types of things in humans. So we have done one study in the active surveillance setting. So this is kind of similar to those preclinical studies where these are patients who are not getting any treatment for their cancer, but it's in prostate cancer. So this is the most common cancer in men, and this whole active surveillance approach is very common. So there's no treatments whatsoever. You just monitor and track the cancer. And so this allows us to look at this idea in humans of whether or not exercise might slow the growth and spread of an untreated cancer. And so these men we recruited to the study, half of them did the exercise program, half of them did not. And we were able to look at some of these biochemical progression markers, things like prostate-specific antigen, PSA levels, PSA velocity, and also prostate cancer cells in vitro. So looking at how these cancer cells grow when they are exposed to the blood or serum of the men who exercise versus the men who didn't exercise. And what we see there is for the men who exercise, their prostate cancer cells grew more slowly than the men who didn't exercise. So this was really the first evidence in humans suggesting that exercise without any other treatments might slow the growth and progression of cancer. In this case, prostate cancer, we don't have any evidence yet in lymphoma cancer patients. And there's good biological plausibility for these findings, including in lymphoma cancers. So good biological rationale for why and how exercise might slow the growth and spread of lymphoma cancers. Some of the key ones that we've looked at that have good supporting evidence are improvements in immune function, especially things like natural killer cell activity and the number of natural killer cells, reductions in adiposity, which can also drive these cancers, improvements in inflammation. So exercise has anti-inflammatory effects that can also have positive effects on cancer, improved insulin sensitivity, insulin-like growth factors, which also are linked to the growth and spread of cancers, and improved antioxidant defense system. So there's a lot of biological changes that exercise causes that might lead to this slower growth and spread of cancer that we've seen in some of these preclinical and animal studies. But the other important finding from this study is, yes, we want to know about the effects of exercise on the cancer, but the psychological impacts of exercise are also very important for cancer patients. You may have a fair amount of stress or anxiety about having cancer, especially if you're not receiving treatments for it. And this study also showed very positive psychological effects for these prostate cancer patients, reduced anxiety about having cancer and reduced fear of cancer progression. So a lot of positive psychological effects from exercise are also very important for patients. So that's sort of before you're receiving any of your treatments. But what about the link between exercise and cancer treatments themselves? Many of you will be on treatments or have treatments coming in the future. And this is a study where we looked at health-related fitness predictors of chemotherapy completion. It was in breast cancer patients because we don't have studies in lymphoma cancer patients, but we're able to look at the fitness level of these breast cancer patients prior to chemotherapy and whether or not it predicted their ability to complete chemotherapy. And we had over 500 breast cancer patients in this study. What we showed in this study is that physically fit breast cancer patients were indeed more likely to complete their chemotherapy. So they were less likely to have any dose reductions and less likely to have any delays in their chemotherapy treatments, which of course is a very important outcome for cancer patients. You want to get all of your treatments and you want to get them on time. And what we showed here is those patients who were fitter and stronger were more likely to complete chemotherapy. So any exercise you do while you're not receiving treatments might help you prepare for receiving treatments down the road and hopefully help you complete more of those treatments. And then there's the issue of exercising while you're getting treatment. So again, many of you are on treatments, want to know what's the effect of exercise while I'm actually receiving some of these treatments like chemotherapy, radiation therapy, or other drug treatments. So we can do the same sorts of preclinical studies that I just showed you, but we can also then add a cancer treatment like a chemotherapy drug. And then we can look at not only the effects of exercise on tumor growth or the chemotherapy drug, but the combination. What's the effects of exercising while you're getting a chemotherapy drug? And so a number of those studies have been done, and I can show you the general results from those studies. Now, this is in a pancreatic cancer cell line, but what you can see here in the green and the blue, exercise itself didn't really have any impact on tumor growth compared to control. And then the black line there, which is a cancer drug called gemcitabine, you can see, as expected, the cancer drug works at slowing the growth of the cancer. But look at the red line and triangles, and that's the group of mice that did exercise while they were receiving gemcitabine. And you can see the drug works more effectively in animals that were exercising than just getting the drug alone. So these data suggest that exercise might actually help the chemotherapy be more effective than not exercising. And there's various explanations for this that we've documented. One is exercise seems to increase blood flow to the tumors. So there's an improvement in the vasculature of the tumor as well as blood flow to the tumor. So this can increase delivery of the drug to the tumors and the other sort of cancerous masses you might have. And the other explanation is that exercise also increases blood flow, blood velocity, and this can damage circulating tumor cells that might be circulating in your system. And when exercise increases blood flow and damages these circulating tumor cells, it makes them more vulnerable to some of these chemotherapy drugs. So once again, we have good biological explanations for why exercise might help these cancer drugs work more effectively. Once again, of course, this is preclinical animal research. These are mouse models, may not generalize to people, but we've just started some research in this area. And one of the first studies published looking at this was in rectal cancer patients. So rectal cancer patients have these tumors, and they will get what's called neoadjuvant combined chemoradiation therapy to try and shrink or eliminate these tumors. So we were able to do a study where we gave half these patients exercise and the other half no exercise to look at, did the treatment work any better in the patients that exercised or the patients who didn't exercise? We obtained a very exciting finding. So you can see here from these data that the patients that did aerobic exercise training while they were receiving this combined chemoradiation therapy, they were more likely to have a complete response to the treatment, meaning that the disease was completely gone. And they were significantly more likely than the usual care group. You can see here the patients in the exercise group, about 55% of them had a complete response to the treatment, where in the usual care group that didn't exercise, only about 15% didn't have or had a complete response. And again, this explanation is exercise might be improving blood flow to the tumors and the vasculature of the tumor. And when you increase blood flow to the tumor, you also increase oxygenation. And this turns out to be very important for radiation therapy. Tumors that have good vasculature and are well oxygenated are much more sensitive to radiation therapy and are more easily killed. So it's possible that exercise might be helping radiation therapy work more effectively by that mechanism. This was a study that got a lot of attention in the media, and they gave a very provocative title here suggesting that patients with rectal cancer who exercised while receiving radiation therapy were more likely to have their tumors disappear. So again, a very exciting and suggestive finding of this benefit of exercising during treatment. I'll share with you some lymphoma data addressing this issue in a moment. So as I said, I've presented some data on breast and prostate and rectal cancer because we don't have a lot of data in lymphoma patients. But this is one of the studies we do have, and it's probably still the best study to date, the most definitive study on the topic, published in the Journal of Clinical Oncology, which is really one of the top cancer treatment journals. And in this study, we compared aerobic exercise, supervised aerobic exercise training program to no exercise in 122 lymphoma patients who were either receiving chemotherapy or no treatment. And we wanted to compare how patients responded to exercise when they were on chemotherapy versus not receiving any treatments. We did 12 weeks of supervised aerobic exercise training. We assessed fitness, different symptoms and side effects, as well as quality of life. And we also assessed their treatment response. So just to share with you the participants in this study, you can see down here with the cancer profile, most of them had non-Hodgkin lymphoma cancer. 22 had Hodgkin's lymphoma. The most common cancer subtype was diffuse large B cell. Follicular was also common, as well as some patients with chronic lymphocytic leukemia. We had all stages of the lymphoma cancer, stage 1 through 4. Some of them had received previous treatments and some of them had not. And as I mentioned, about half of them, close to half of them, were on chemotherapy at the time of the exercise intervention, and about half were off treatment. So the first important finding we reported is that this exercise training program had very large effects on their fitness levels, their VO2 peak. And you can see we had very positive effects for patients on chemotherapy or off treatment. And the chemotherapy patients showed that if they didn't exercise, they actually had a decline in fitness over the course of their chemotherapy treatments, where the patients that exercised during chemotherapy got a very large improvement. And the patients who were off treatments or either hadn't started treatments yet or were between treatments also got a very large benefit. And this might be important. Think back to that breast cancer study I just showed you, where patients with a higher VO2 peak, better aerobic fitness, were more likely to complete chemotherapy in the future. So this is a really important finding that might help these patients who are off treatment prepare for future treatments. Also important, we found big improvements in quality of life. That's, of course, important for all patients. We found a big effect overall, but again, patients on chemotherapy benefited just as much as patients who were off treatment. And those on chemotherapy, as we oftentimes see, without exercise, they had a decline in quality of life during chemotherapy, but the aerobic exercise training completely reversed those effects and showed very positive effects on quality of life. We also showed positive effects on fatigue. This is a very important side effect. I suspect many of you have experienced it. And it's intuitive to say that the best approach for fatigue is to rest and take it easy. And in the past, many oncologists also recommended that as well. Patients who are tired should rest and take it easy when you go through these treatments. But what we found in this study and many other studies, exercise is really one of the best treatments for fatigue, even for patients on chemotherapy. The higher scores here are less fatigue, so fewer fatigue symptoms. And you can see here that the group that did aerobic exercise training reported less fatigue after chemotherapy compared to the group that rested and took it easy. So this is a very important finding. Sleep quality is another important issue. Patients with cancer and on treatments may not be sleeping very well, and this can be linked to the fatigue that they experienced. And this is the one finding we showed where the benefits were really just for patients on chemotherapy. For patients who were not on chemotherapy, their sleep quality improved. So those scores going down there means fewer problems from sleep quality. So if you're off treatments, over time, your sleep quality improved. But for the patients that were on chemotherapy and they didn't exercise, their sleep quality got worse. But the aerobic exercise group, their sleep quality improved. So another very important symptom that can really affect fatigue and quality of life and other aspects of health in lymphoma patients. Perhaps most important of all, that you guys might be most interested in, just like in those previous studies, we could look at response to treatment. And this is, of course, restricted to the 54 patients that were on chemotherapy at the time of the exercise intervention. And after the chemotherapy, for all of these patients, we can look at whether they had a stable response to the chemotherapy, meaning no change in the number of tumors or the size of tumors, whether they had a partial response, meaning some tumors shrank or disappeared, but they still have some lymphoma cancer left, or whether they had a complete response, no evidence of disease. And what you can see here, it's not statistically significant, so it's not a reliable finding, but it's in the direction that we would hope. So for the patients who exercised during chemotherapy, about 46% of them had a complete response to the chemotherapy. For those patients who didn't exercise during chemotherapy, about 31% had a complete response. And again, very likely due to these mechanisms of exercise improving blood flow to the tumors, improving vasculature, and therefore better chemotherapy delivery to the tumor masses. And also this increased blood flow that's caused by exercise that can damage these circulating tumor cells and make them more vulnerable to the chemotherapy. So a very suggestive finding of a potentially important benefit of exercising while you're getting chemotherapy for lymphoma. This study also got some media attention. I think the title they came up with is a very good title and probably the key take-home message for this talk. Exercise is indeed good medicine for lymphoma patients. And it's good medicine even for lymphoma patients receiving chemotherapy. So the take-home message of this talk then is don't take cancer or don't take lymphoma lying down. We think there's lots of benefits from exercising before you start treatments, during treatments, and after treatments, improving many outcomes related to fitness, quality of life, and potentially even some of the cancer or disease outcomes. But this is not necessarily easy for any cancer patient group to exercise, and it's not obvious to a lot of cancer patient groups that they should be exercising. So this is a study we did in non-Hodgkin lymphoma survivors, asking them how much exercise they did before they were diagnosed with cancer, while they were on active treatments like chemotherapy and radiation therapy, and how much exercise they do when they're off treatment or post-treatment. And you can see a very clear pattern here that most of these patients report they're doing very little exercise while they're receiving treatments, almost no vigorous intensity exercise and very little moderate intensity exercise. They do kind of increase their exercise a little bit when they're off treatment or after treatments, but it's not back to pre-diagnosis levels. So going on these cancer treatments has a very negative impact on exercise levels, and it seems to be a bit of a permanent impact on exercise levels. So many of you might have given up your previous exercise programs when you were diagnosed with lymphoma cancer and then going through these difficult treatments. So it can be a real challenge to stay active, but hopefully you've seen from this talk today that there are potentially a lot of benefits of exercising before, during, and after these lymphoma treatments. So what do we recommend for lymphoma patients and other cancer patients as well? There's a few general exercise principles that you can follow. In general, avoid inactivity. Sedentary behavior may be bad. So you might have heard about this, sitting for prolonged periods of time without getting up and moving around can be unhealthy. And so even some exercise may be beneficial. I'll give you the guidelines in a moment, but even if you can't achieve those exercise guidelines, generally what we find is some exercise is better than none. So doing what you can may be helpful. And we do find that more exercise is better. So we call that kind of a dose-response association. That is, the higher dose of exercise you do, the better the response. Almost the same like you would see for chemotherapy other drugs. The more drugs you get, typically the better response. So if you're able and willing, doing more exercise can be helpful and lead to better outcomes. If you haven't exercised in a while, especially since your diagnosis with lymphoma cancer, you definitely want to start easy and progress slowly. So exercising to tolerance. You don't want to just start right in doing a large amount of exercise. You want to progress it fairly slowly until you are able to do some of these exercise prescriptions. So that's really important. So what is the recommendation? The general recommendation is 150 to 300 minutes per week of moderate intensity aerobic exercise. So this is walking, jogging, cycling, swimming, any of those types of cardiovascular endurance exercise or aerobic exercise. And 150 to 300 minutes seems to be the sweet spot. Less than 150 minutes, there are some benefits, but 150 really starts to get the most benefits. And then up to 300 minutes, you get additional benefits. Going beyond that, there doesn't seem like there's a whole lot of additional benefits when you start to go beyond 5 hours a week of exercise. But how you spread out that exercise is not really that important. So you get this 150 minutes per week, but it doesn't seem to matter if that's 5 days per week at 30 minutes or 3 days per week of 50 minutes, or even 7 days per week at 21 or 22 minutes. You can kind of spread it out over the course of the week. We certainly recommend at least 3 days, not to try and get it all in 1 or 2 days, to spread it out at least 3 days, but 4, 5, 6 days is also fine. And by moderate intensity exercise, typically we mean, at least brisk walking. But that will depend on your fitness level. For those of you who might be very deconditioned and have not exercised in a long time, even casual walking might be moderate intensity for you. For those of you who are reasonably fit, brisk walking will get you into that moderate intensity zone. And for those of you who are very, very fit, and there's lots of lymphoma patients who are running half marathons and doing triathlons and so on, brisk walking for them might only be light intensity exercise. But by moderate intensity, typically you want to notice that your heart rate's going up, your breathing rate's going up, there might be some light sweating. So you do want to push yourself a little bit. I tell patients, if somebody were to see you walking, they would think you're late for an appointment. So you got some pace in your step and you're trying to walk fairly quickly. We also recommend, instead of moderate, you can do vigorous, and you can see it's roughly half the amount. So vigorous kind of counts for double the amount of moderate, 75 to 150 minutes of vigorous intensity aerobic exercise, if you are able and willing to do that. So this is the jogging and the fast cycling and so on. So here, your heart rate is up substantially, you're sweating quite a bit, and it's a real challenge to breathe. So vigorous intensity exercise can be very beneficial as well. 2 to 3 days per week of strength training. I haven't really talked a whole lot about that, but the strength training exercises can also be very important if you're able to do aerobic and strength exercise. I know that's asking a lot. Patients are doing a lot of different things. You've got a lot of treatment appointments and medical appointments, and there's other complementary therapies you might be looking at. So it's a lot of exercise to do. Aerobic exercise alone is beneficial. Strength exercise alone is beneficial. And certainly the combination of the two is very beneficial. And then add activity supplements throughout the day. And what I mean by that is that's the getting up and moving around, taking the stairs instead of the escalator, parking at the far end of the parking lot and walking into the grocery store or walking around the mall, those types of things, getting up and moving around, breaking up your sitting time. Those types of things are also very helpful in addition to doing a good quality exercise program. I will end my talk there and be happy to entertain any questions, comments, or if you have any exercise tips for the group.
Thank you, Dr. Krania, for that wonderful presentation. Now we'll just take some questions. If you do have a question, please be sure to leave it in the Q&A box, which is at the bottom of your screen. So we do have a question that says, I have a mini trampoline and I've heard that using it helps to drain the lymph. I have lymphoma and I wondered if it's good to move the lymph around, or does the exercise move the lymph cancer cells around the body?
Yeah, that's a very interesting question. I hadn't heard specifically about the trampoline, but exercise, the cancer cells are probably moving around the body anyways. If you have existing lymphoma masses, they may be shedding some cancer cells, and these circulating tumor cells will move about the body. Exercise will not increase that or make it worse. But as I said, what it can do is damage some of those circulating tumor cells, because when you're sitting at rest, your blood's flowing throughout the body. And this is kind of like these circulating tumor cells going down a water slide. They kind of spin around, they move. Some of them might die. But when you engage in higher intensity exercise and you get that blood flowing much more rapidly, this is like these circulating tumor cells going down whitewater rapids. And it's much more likely to kill those circulating tumor cells. And if it doesn't kill them, it makes them more vulnerable to chemotherapy. So I think that's kind of an important role of exercise in terms of the blood flow and damaging some of those circulating tumor cells.
Thank you. And another question we have is, as an immunocompromised patient, should I avoid swimming in public pools as a form of exercise to avoid possible infection?
Yes, that's a very good point. And that is a recommendation. If you are immunocompromised or you're on chemotherapy and you become neutropenic, it's important to watch out for places where there might be a higher risk of infection. So going out to a public gymnasium may not be a good idea. So I would certainly agree with that recommendation.
Next we have, because of lymphoma affecting my bones, I was advised against doing high intensity activities such as running, as I am at a higher risk of bone fracture. What physical activity recommendations would you have for me?
Boy, all your patients are getting very good advice from their doctors. So absolutely. One of the biggest concerns with exercise is any bone involvement, whether it's directly from the cancer or whether it's metastatic bone disease. And your participant's correct that that can increase the risk of fracture. So it'll depend on which bones are involved, because we can develop exercise prescriptions where we can work around what particular bones might be involved with, for example, if we were doing a weight training program. But in terms of the low impact exercises, yes, something like swimming is a great activity if there's any sort of metastatic bone disease, but even stuff like an elliptical. So you're on an elliptical that's going, it's kind of like riding a bike. That can be very low impact exercise as well. Something like yoga can be fantastic. I didn't talk much about yoga, but there's lots of benefits for cancer patients from yoga, which can also be a very low impact activity.
And somebody else said, thanks for your presentation. It was great. As we go into winter, what is the best aerobic exercise that we can do within our limited space at home?
Yeah, great question. So if you're able at all to afford a home piece of exercise equipment, I think that's fantastic. You know, it's great to have a treadmill in your home for the winter months. I agree that, you know, for 6 months, we're fine. And then for 4 to 6 months, depending on where you live in Canada, it's very difficult to get outside. It can be risky trying to walk and run. And of course, it's impossible to bike. So if you can get a home treadmill or a home cycle ergometer or an elliptical, that can be a great investment to keep you exercising 12 months of the year. Without that, I mean, we do things like jumping jacks and marching in place. You know, if you go online and just search aerobic exercise without exercise equipment, these are some of the recommendations that they can give you to be able to get your heart rate pumping without needing any exercise equipment. And stairs. I mean, I've got, going down to my basement, I have 16 stairs. Going up and down stairs is one of the best aerobic exercises you can do.
Thank you. And should I exercise the next day after I get only 5 to 6 hours of sleep?
Yeah, good question. The whole issue of sleep is really gaining a lot of attention in terms of some of the problems that poor sleep quality causes. I would say, you know, the recommendation we make, and I tell this to patients, you know, typically 3 days per week, 30 to 45 minutes of moderate to vigorous intensity exercise. So given that you can choose which days you exercise, you can work around these so-called bad days. If you're on chemotherapy and you feel particularly sick, you can take a day off and say, I'm going to exercise on this day instead of this day. And I would say the same thing with poor sleep. If you get up and you don't feel well that day and don't feel energized, then you can take that day off. Now, if you're sleeping poorly all the time, then that gets a bit trickier. You do want to try and do some amount of exercise to help you get your sleep quality back on track. But if it's a one-off poor sleep, skip that day and pick it up again the next day.
Okay, and for those of us with a treadmill, how fast should we walk if we're just beginning the exercise?
Yeah, probably 3 miles per hour is plenty, and you can even start at 2 miles per hour. It's a nice casual, slow pace to get started. You get to 3 miles per hour, for most, that's a nice, comfortable pace. Once you get to 4 miles per hour, that's kind of your brisk walking. You're having to really go to keep up with 4 miles per hour. So you could start in that 2 to 3 range and see how you go. Great thing about treadmill is once you do get a little bit fitter, increasing the grade can be extremely beneficial. It becomes a bit of a low impact exercise for really gaining intensity. So bumping up that grade to 5% or 10% can really turn walking into a vigorous intensity exercise.
Okay, and where can we find information about your lymphoma and exercise-based research?
Yes, good question. I can send you, Gurjot, the studies that we've done on that area if you want to send them out to patients. You can search online for exercise and lymphoma cancer, and I suspect a bunch of my studies will come up, as will some other studies. So there's some other groups doing some studies on this topic as well.
Yes, for sure. Please send them my way. I would love to send those out to our patients. Right. And what are your thoughts on the 10,000 steps a day movement?
Yeah. 10,000 steps are fantastic. It's just a way of making sure people get a lot of movement in the day. And we know without tracking those steps, a lot of people are only getting 3, 4, 5,000. And that's, very, very low. There's nothing magic about 10,000, but it just shows that you're getting lots of activity, which is good. The other qualifier I would add is, part of those 10,000 steps to make sure that about 3,000 of them are brisk walking. So not just shuffling your feet all day, moving around and getting 10,000 steps. But if you go out for a nice brisk walk for 30 minutes, you can probably accumulate about 3,000 steps. So we want to make sure some of those 10,000 steps are good quality walking that has a little bit of pace to it to get the intensity up and get some of these benefits that I've talked about.
We actually had a Laps Around Lymphoma event where we were challenging everyone to walk 10,000 steps a day. So that's definitely advice we'll take for next year. Thank you for that.
Fantastic.
And those are all the questions that came in, and I'm glad we were able to get to all of them. So somebody said excellent presentation. So thank you everyone for joining the final info session of our 7th annual conference on lymphoma and CLL. It was a pleasure hosting this event over the course of the 3 days, and I hope you were able to access the information that you were looking for. Before you leave today, please be sure to fill out the survey regarding your experience, which you can find on the white bar on the main page so that we can best plan for next year. I will now like to direct your attention to attend the closing marks. Thank you everyone, and until next time.
Thank you, Gurjot.
Thank you.